I would like to welcome everyone to today's webinar, which is part of our Improving Ohio's Health series. Today's webinar is titled Technology Tactics to Make Patient Engagement Easier, Improving the Health of Patients with Hypertension and Diabetes. Presenter today will be me. My name is Scott Mash. I'm with the Ohio Health Information Partnership. We're also known as CliniSync. So let's get started. So the topics we're going to be discussing today, really we're going to look at the importance and use of technology for your patient engagement program and how you can use those to improve outcomes, especially for your patients with hypertension and diabetes. Specifically, what we're going to look at is we're first going to define what is patient engagement. We're going to talk about why that is important. We're going to look at some of the different technologies that you can use to support your patient engagement program. And then we're going to touch briefly on some of the barriers. So I always like to start out with kind of defining the topic. So what I did is I did some research online and snagged a few different definitions of what patient engagement is. You know, the first quote I got from Healthcare IT News, patient engagement was defined as a concept that combines a patient's knowledge, skills, ability, and willingness to manage his or her own health and care with interventions designed to increase activation and promote positive patient behavior. The second quote on here is the involvement in their own care by individuals and others they may designate to engage on their behalf with the goal that they make competent, well-informed decisions about their health and healthcare and take action to support those decisions. Now in this quote, I think the key term, the key phrase is, and others they designate to engage on their behalf. A couple more real quick. And patient engagement is a broader concept that combines patient activation with interventions designed to increase activation and promote positive patient behavior, such as obtaining preventative care and exercising regularly. And finally, the last one, nice and short, but I think it hits the nail right on the head. Providers and patients working together to improve health. Really, this focuses on the partnership between the healthcare team and the patient. Now, most of the articles and studies out there kind of agree that there are three levels to patient engagement. The first is really the foundation. It's the most important. It's getting patients to understand their conditions, understand their health, understand their medications. The second one is really using patient engagement to enhance the time that patients spend with their care teams, because really the more the patient understands their medications, their conditions, and that they're actively involved in their health care between visits, then the better the questions will be that they do ask during those visits, and that maybe they'll involve their family or their caretakers, and maybe they'll interact with the care team, with the physician and their support staff between visits. And finally, the third is providing tools and information to help the patients manage their chronic conditions. Now, patient engagement, if you rely only on technology, you only focus on that piece, you're not going to have a lot of success, because patient engagement is a very, very broad concept. Technology is an important piece of it. Now, this is a framework that I found online. This is a framework from FHIMSS. Now, I did modify this a little bit. But it kind of gives you a good overview of the breadth of what a successful patient engagement program should include. So if we look first at the individual pillar there, this really is all about collecting data so that you can better understand the patient, their specific needs, their challenges, details about their home life or socioeconomic factors, and it's all about educating the patient, providing them with some tools, providing them with some just information, and really trying to get them to partner with you in their care. Now, the second pillar is the healthcare team, and this is really about trying to build a shared understanding between the patient and the different healthcare providers out there. Again, this really starts with the patient-physician relationship, but also extends to the hospital, ED, and really in their home, because most of the healthcare really occurs in the patient's home. So we just got to structure your program around that. So with the organizational pillar, this really focuses on partnerships within your own health system to promote better care for the patient. Think about, partnering with your chronic care management team. If you have a team that works on PCMH, what tools or training is available as part of that program. Sometimes if you're in an ACO, even the ACO will provide some services or programs or education focused on the patient. And the final pillar there is your community. Really encourage your patients to become actively involved in community-based educational efforts or support programs or any other group in the community that would benefit the patient in becoming compliant or becoming actively engaged in their health care. And technology really can support all of these pillars. So now that we've kind of laid the groundwork around what is patient engagement, looking at the different frameworks, really you have to define what patient engagement means to you, means to your organization, so then you can develop a plan for success. There's just no single all-encompassing definition out there. I kind of like this graphic. I think it does a good job at least highlighting the major points of patient engagement. So now let's talk about why patient engagement is important. Love these two quotes. The first one is adapted from Dr. Terry McGinney. The lack of patient engagement is the Achilles heel of healthcare delivery. And while this second quote is not specific to healthcare, I think it hits the nail right on the head. Tell me and I forget, teach me and I remember, involve me and I learn. Involve me and I learn, that is probably the best definition of patient engagement that I was able to find out there. Why we really want to avoid patients spending hours on the internet, especially those hypochondriac patients that are come in and say, gee, I think I have 100 different conditions. There's an upside to that. At least the patient's interested. At least they're out there looking, they're researching, they're reading, they're trying to learn more. When we have those patients, we want to focus them. We want to focus those patients on sources of information that have been vetted, on their own care plan, on the information that the physicians is providing. Now, there are numerous studies out there that have found that patients really lack health literacy. They don't really understand their full medical conditions. They don't really understand their medications, especially those patients that are on numerous medications. There's just a number of studies. They may look you in the eye and tell you they understand, but odds are they probably don't fully understand. Medication adherence and lifestyle choices, of course, they have a greater impact on outcomes in the care provided by the physicians, because the patient's action or inaction at home is going to have, it's just going to have a greater impact on the true outcome, because there's only so much you can do in a visit, and they're at home more than they're ever in the office. Now, think about the impact of patient engagement on overall healthcare costs, how it can reduce readmissions, how it can improve outcomes. Also think about your patient engagement program in context of some of the new emerging payment reform models, ACOs, PCMH, MACRA. Those are all very focused on quantity over quality and lowering overall healthcare costs. One of the pillars in lowering healthcare costs is the patient, getting the patient engaged. Your patient engagement program can absolutely reduce costs. Of course, you're going to have increased communication through the use of technology. You're going to have increased patient satisfaction, and that is key with this change to value-based purchasing, because your satisfaction scores are absolutely critical in your future reimbursement. And of course, it's patient engagement. A good, strong patient engagement program is going to have a positive impact on your population health program as well. Now, we all know that sicker patients have higher costs, but patients who have the least comprehension, those patients that don't have a health literacy, and then they're not actively engaged, they have a 21% higher healthcare cost than those patients that are fully engaged. And other studies show that 75% of healthcare costs are really due to chronic conditions like hypertension and diabetes. So if you have a patient who is fully engaged, that is continually educating themselves, and that you're assisting with that education, that are adhering to their their care plans, a small reduction in the cost has a huge impact. Now we are going to talk about, we're going to transition and talk about the various technologies that can be utilized in a patient engagement program, or that you kind of see around today. First, we're going to talk about your EHR. Now, I really believe that the EHR is overlooked as the foundation, the key tool in a patient engagement program. And the reason I feel that way is because the EHR is the source of all information about that patient. If you're collecting the information up front, you understand your report tools, you can develop the reports, develop a feedback loop that can truly engage the patient, and that can provide individualized engagement to those patients. And of course, your EHR, it does provide the medication and problem-specific education to the patient. Hopefully, you have your EHR configured so that you can also push that information to the portal. I think it's great to print and hand it to the patient. Absolutely. Some folks like the look and feel of paper, but when they misplace that, they leave it in their car, whatever, have that same information available on your portal for the patient. Now, your EHR must be configured appropriately to ensure that the appropriate data is flowing over to your patient portal. And your EHR can be used to visually engage your patients during the office visit. Humans are very visual creatures. Sit next to the patient. If you take a laptop in as part of your visit with the patient, and many providers do, sit next to the patient. Spin that screen around, show them their information within the EHR. If your EHR has the ability to do graphing, let's say it's you're looking at an A1C and you pull it up and you graph it over time, show the patient that graph. Let them see their data, because that might stick with them. Some people, they are engaged by, the spoken word, when you're talking to the patient. Other people are just visually engaged. So try every avenue to get those patients engaged and interested and active in their own care. And I just think the EHR can be a tool in that. Now we're going to shift towards the patient portal, because this is the primary tool for patient engagement today. Now, nearly every hospital and physician in the country has a patient portal because it was required by the Meaningful Use Program. Starting in, 2014, it became a base requirement. Prior to that, it was a menu option. Now, many clinicians to this day feel that the patient portal really provides no value, or that patients just won't use it. Now, I would personally challenge those groups by saying, what have you really done to promote your patient portal and to ensure that it is a tool in your patient engagement program? Do you just ask for a patient's email address and hand them a flyer that says, here's how you log in? Because that's what a lot of organizations are doing that say, hey, patients don't want this. If members of the care team really sell that patient portal and say, you can get in here, you can do all kinds of different things, you can see your labs, you can see your radiology, you can see all these results, they're going to log in. Now, we've all kind of got a basic, there's basic functionality that we expect in other sectors that we need to make sure are within the patient portal. give those patients, kind of a reason to log in. So the basic functions every portal should have is bill pay. They should be able to at least receive an appointment reminder through the portal. If not, also have the ability to request a future appointment. The refill request, I think it's really important to have that in your portal, and of course secure messaging. These functions will give patients a reason to log in even if they're not fully engaged in their healthcare. It's real simple to go online and pay your bills and save a stamp. But when these patients are logging in, they may just click on a clinical item. They may just click on a result. They may just click on some patient education and then become more engaged, more active in their own care. So these 4 basic functions really need to be enabled in your portal. 99% of the portals have these features. Some folks have them turned on. Some people are leveraging these and many, many other features within their portal. Now, in the early days of portals, in my previous life, one of my previous employers, we were an early adopter of the patient portal, and I know I personally heard this from a lot of clinicians saying, that patients they're not going to understand, they're going to log in, they're going to read all this information, and then they're going to have tons of questions for me that I got to sit there and answer before I can ever start, with the intent of that visit. Well, I'd challenge those folks and say, gee, that sounds like patient engagement. They didn't understand something in their medical record, how it applied to them. They didn't understand a problem, a medication, why it was there. And they're asking questions. They're wanting to learn. That's patient engagement. So there are some basic clinical elements that your portal really should provide, and hopefully provide in a very simplified and visual format. You really should have your active problems or conditions. Hopefully, that active problem list, if they have hypertension, diabetes, or COPD or something, that they can click on that problem and get additional information about, here's what diabetes really is. Here's some a means of managing your care, watch your diet, lose weight, whatever, just some educational information. The same with medications. They should have a medication list, and it should have, hopefully, the ability to click on that medication and get some information about that medication around adherence. Again, medication adherence is one of the areas that a patient engagement program can have a dramatic impact. Hopefully, your portal has the ability for the patients to access their lab results, and the good portals will allow you to map or graph those results over time. Again, humans being very visual, if they can see their A1Cs creeping up over time or their weights creeping up over time, that will get their attention. And of course, it's also critical that you have the clinical and discharge summaries, because when you're sending a patient home after they've been in the hospital, their mindset may just be, I need to get out of here. But when they get home and they start feeling bad, or they got a question about their medication, boy, if they can get on that portal and get to those discharge summaries, that would be a huge win. Now, there are some basic keys to ensure that your portal initiative to support your patient engagement program is successful. First, your portal really has to have a simple and intuitive user interface. Now, they are getting better. Some are better than others. If you don't feel your portal is intuitive, is simple to use, push your vendors. Put pressure on your vendors. You're a paying customer. They will listen if you yell loud enough. Ask your patients what they like or dislike about the portal, and give that information to the to your vendors. You want to make sure your portal supports multiple platforms. Now, what I mean here is that that I can pull out my laptop, I can look on my iPhone, or my Android phone, or my iPad, any tablet device. You want to make sure that your portal is accessible on any technology. Now, you got to make sure also that you provide timely access to the clinical information. The information must be pushed over to the portal as soon as absolutely possible, because patients are more likely to log on when they get home, so strike while the iron's hot. Don't wait 3 or 4 days to push that information to the portal. Get those encounter summaries, get those lab results, get them to your portal. It's also key that your practice or your organization dedicates resources to help patients out with the patient portal. Initially with signing on, kind of giving them a once around on how to traverse through the portal, and also to be a resource if that patient is at home, they're having problems with the portal, they don't know where to find something, that they have somebody in your practice, in your organization that they can call. It's also critical that you provide multi-channel training to your patients on the portal and to encourage that they use the portal. I said earlier, don't just give the patient a flyer. No, a flyer is a good tool. So, have a very simple, easy to read flyer with, screenshots and whatnot that you can provide the patient. Think about doing a video that you can post online. It doesn't cost anything to record a YouTube video and put it out there. You can show how to get around the portal, maybe answer some questions, maybe even talk about why, why it's important that the patients use the portal. And of course, one-on-one assistance when that comes up. And think about other ways to encourage use of the portal. Maybe when you patient calls in about their results, you can say, hey, those are available on the portal. Let's log in and take a look. We'll just talk about them right now. Or if you have a patient that calls in requesting a refill request, a refill on a medication, by all means, process it and take care of them and say, hey, next time we can save you some time so you don't have to be on hold. You can request those refill requests right through our webpage or right through our portal, and if you'd like, I can take you through and show you how to do that. I want to show a couple really good examples of a portal. Now, this is actually a real-world screenshot from a portal, and I really like this layout. It's intuitive. It has the major items right there in front of the patient. Of course, you got here at the upper left-hand corner, you've got the health summary. So it kind of gives you the highlights, height, weight, whatnot. I like this action center down below because it's kind of notifying the patient of, hey, you've got an unread email. You've got new information or new clinical items in your record, and you got these overdue items. You're overdue for a lab. You're overdue for a colonoscopy. And this is the splash screen right when the patient logs in. Of course, in the upper right-hand corner, they can see any of their upcoming appointments. This particular screenshot, they have none. And then you can see even recent activity down in the lower left-hand corner. I just think this is a nice, intuitive user interface. Here's another example. Now, this one's a little bit busier, but it does provide some information that the other dashboard did not. Most notably in the upper right-hand corner, there's that bill pay that's giving the patient a reason to log in. And then right down below that are links to vetted patient education. So we get them to log in to pay their bills, and then we keep them. Maybe, just maybe, they'll click on one of those educational items down below. Some of the patient portals will display education specific to conditions or medications that appear in that patient's medical record. And if your portal is configured in such a manner that it does that, leverage it. So a couple good examples of patient portals on mobile devices. More and more of your patient portals do have an app, whether it's for an iPhone or an Android phone. And what I really like about these mobile apps is it allows patients to engage whenever and wherever they are and whenever they think about it. So, they could be, getting ready for work in the morning. They take their last blood pressure pill and they think, oh my gosh, that's my last pill, and then pick up their phone and request a refill right then and there. So that's going to increase medication adherence. Or maybe they're just left the doctor's office and they think, oh my gosh, I forgot to ask a question. They could fire up this app, go into the secure messaging feature, and boom, 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 send that message over, and stay engaged in their care, close those gaps on their health literacy, increase the patient's knowledge of their medications, and their conditions at any point, anytime, wherever they are. Now, regardless of those that think that patients aren't going to log into their portal or they don't see it as a great tool, every study out there states that patients want access to their clinical information. They want access to online services, online education that's specific to them. And that's what the patient portal is all about. It gives that patient problem and medication-specific access or information. Now, the quote on this page is from one of the organizations here in Ohio, one of the health systems, happens to be Marietta Memorial. It's a group that Kathy and I work with quite extensively. They have a great program built around their portal. They've got resources dedicated to it, and they see a lot of use of the portal. This quote comes from Mr. Tim Gray, who's their CIO, who says that our patients want to care for themselves. They want to engage and help us help them to achieve better outcomes with their health. I do believe that our patient portal is helping us align our initiatives such as ACO and Pop Health, where patient engagement is the huge driving force. Now, why do patients want access? And again, more and more patients are wanting access to their health information. Now, a lot of them, they're focused on the bottom dollar. You know, they're seeing increased deductibles, increased out-of-pocket expenses. So there is a financial benefit for them to become more engaged. And if that's what it takes, if you got a patient who's non-compliant, then all of a sudden their health plan changes, they got more out of pocket. If they get involved for no other reason than to save a buck, then make use of that. Don't pass on that opportunity to get them engaged. Insurance providers, the private insurance providers are really encouraging their beneficiaries to become more engaged, to do more self-management, to learn more about their problems and their medications. So build on that. Partner with those insurance providers. Find out what they're saying to the patients, and provide them with information about your portal. And again, there is an ever-increasing prevalence of mobile devices that makes it absolutely so much easier to access right when you have a thought about your care, whether it's a refill, you need to reschedule an appointment, you need to see when your next appointment is, you need some education, you need to contact your provider. Cell phones are key. Now, the information on the next two slides comes from a CMS study that was built from data in 2013 and 2014. This slide really is to show you who, according to the CMS study, is really accessing the patient portal. Of course, those young 20 to 29 kids, those are the folks that are very, they're used to technology. They grew up with technology, so we kind of expect to see high numbers there. But then when you get into the 40s, 50s, and 60s, that's when you start having these conditions. You're a healthy young pup at, from 20 to probably 35, but around 40, hey, your blood pressure's going up, your weight's going up, now you got diabetes. Now you have more reasons to access the patient portal and get engaged. Now, my past experience, again, at a former employer, was that patients 40 and up, and a surprising number of patients 60 and up, were our primary portal users, again, because those are the patients that are sick. Those are the patients that have a reason to log into the portal other than to pay a bill or to request an appointment. Again, this is from the CMS study, but this kind of focuses on what functions are patients using within the portal. Of course, the big one is, they're using the portal to monitor their health, check on their medications, they want to see their lab results. There's some folks that download the information. Now, this is something I personally have done. I've downloaded the information. The reason you would want to do that is so you can import it into a personal health record, because one of the downsides to patient portals is that everybody's got one. So patients have multiple accounts that they have to manage. Some health systems have 4 portals. I actually know of one health system that does have 4 separate patient portals, because they have inpatient and outpatient, and then 2 of their outpatient programs have their own portal. So you can download that information, import it into a personal health record to kind of build a consolidated view. A smaller number of folks download the information and send it somewhere else. But what I want to focus on here is that halfway down where it says shared information with at least one other party. Almost half of the patients did that in 2013 and 2014. And then this kind of breaks it down into who did they share this information with? They shared information with someone else involved in their care, with another healthcare provider, or with another family member. Your engagement program shouldn't just focus on the patient. It should focus on members of their family, their care providers. Some patients, they've got a cousin or a child or somebody taking care of them, and you need to engage that person as well. Sometimes that's what it takes to get a patient engaged, is to work through their spouse. Get their spouse involved, educated. Now, I do know that, there are some concerns with HIPAA, but HIPAA does allow for you to engage their caregiver so long as you follow certain standards and whatnot. But the point here is folks do access it. They do share the information. They do talk about it with their loved ones, and your patient engagement program should focus on them as well. Let's talk about secure messaging real quick. The great thing about secure messaging is patients can use it to just ask a simple question, maybe something they forgot to ask during a visit, maybe they just need some clarifying information, and rather than just making an appointment to ask that question, they can get the question answered and allow the care team to spend the time that they would have, I don't want to say wasted, but spent with that patient, where they could spend it with another patient who's really sick, who really needs the visit, rather than somebody just kind of simple question that they need to be answered. So we're going to focus a little more here on secure messaging, and really it's it's kind of like email, but it's built within the portal. A secure message, the capability to send and receive a secure message from your healthcare provider, really can build trust. It's building that relationship between the patient and their care team. That relationship will improve trust with the patient, and if the patient trusts you, they're going to listen more. There's a higher percentage chance that they're going to be fully engaged in their care. So secure messaging through your portal is HIPAA compliant. It doesn't necessarily need to be a message that goes directly to the physician. It can be vetted. It can go to any member of the care team. It can go to primarily to the receptionist, who then could see the message and see if it's a refill request, if it's a simple message that one of the other care team members can answer for the patient, or if it's something very complex, then they can forward it on to the patient, or to the physician. But it doesn't necessarily need to be physician and patient. Secure messaging is a great tool for care coordination between visits and monitoring chronic conditions. Think about if your organization has a care coordination team, this can be another communication tool that they use. Hospitals, here with stage 3 of meaningful use, secure messaging will be extended to the hospitals. Think about a lot of hospitals that we're talking to will say, well, gee, why would we need secure messaging? We take care of the patient. When they're discharged, they go see their provider. I think the key is making sure that patient does follow up with their provider. Use a secure message just to send a quick little blip to them saying, hey, have you scheduled an appointment with your primary care provider? That might be enough to trigger that patient to do that, to ensure that they stay engaged and compliant. Secure messaging has been found to contribute to patient satisfaction because they feel like they can reach out and engage the provider and get an answer from the care team. It really does feed back into your satisfaction scores. Now, there was a 2014 study done that found patients with 2 or more chronic conditions who use secure messaging to ask a question or to engage the healthcare team did not reduce the number of visits. What it does do is make those visits that they have more meaningful. They can get a little question answered between visits that may trigger some other thoughts in their head, or may, increase their literacy. So the next time you're face to face with that patient, it's a more in-depth, a more meaningful visit. You've shaved off the easy stuff through secure messaging. Now you can get to the, to the more critical points of the visit. There are several other current technologies available today that would be useful in supporting your patient engagement program. Some of these are extended portal functions. Some of these are technologies and functions outside of your portal. One that I'm starting to see a lot more of today is secure texting applications. A good example of this is Imprivata Cortex that I know a lot of folks are out there using. But what this is a HIPAA-compliant phone-based texting between the patient and some member of the care team. Doesn't necessarily need to be the physician, and most cases it's probably not going to be. But think about how members of the care team and care coordinators and anyone else in healthcare could leverage the ability to send a text message to a patient or receive and respond to a text message from a patient. There are HIPAA secure apps out there today that you can do this and stay compliant with HIPAA. Second, social media. Do not underestimate the power of social media. Now, granted, there are some HIPAA concerns, but if you don't have a social media site for your practice, your organization, get one set up. You can share information on diabetes, hypertension, or other conditions. You can announce educational programs that are available to patients either from your organization or from a community organization. You can provide links to verified online education, links to videos. There are just a huge number of folks that use social media. I'm a social media addict. I would be willing to bet that half of the people listening to this webinar have checked Facebook at least once, or Twitter. So leverage that. Leverage that as a technology to increase your patient engagement. I think online surveys are great. Now, again, there's HIPAA concerns here. You can't really ask problem or patient-specific questions, but it's a great way to get feedback. Think about simple questions about, a survey that just says, hey, how can we keep you focused on your health and improving your condition between visits? What do you like or dislike about our patient portal or these other technologies? Or what can we do to make the educational information we provide you easier to understand? These simple questions are going to provide you with a wealth of technology. Now, there is an initiative out there called Open Notes. And this is an initiative that promotes the direct sharing of physician notes to the patient portal. This gives the patients a view into their care encounters and can help them maintain information or communication with the doctors. There was a study of the Open Notes pilot that patients really respond well to this kind of transparency, and found that 80% of patients who have access to the physician notes felt more empowered. And that's what you want to do. You want to empower the patient. Now, some patients, a very low number, did report that they felt a little confused by this wealth of information, but the overwhelming majority just responded very, very well to it. And there was a recent Geisinger study that showed that Open Notes improved patient engagement and, as a result, medication adherence. Patients visiting physicians who adopted Open Notes were 5% more likely to adhere to their treatments. Another technology that's out there today is waiting room video displays. Now, this does include both your, like a TV mounted on the wall, iPads or wall-mounted touch screens, because your waiting room is an untapped resource. It's an untapped source of teachable moments. It just could increase patient literacy, help them understand things. Keep this in mind, that the typical visit to your doctor, you spend 20 minutes in the waiting room versus somewhere between 6 and 12 minutes with a physician. So you got 20 minutes. You've got an audience for 20 minutes. They can either look at, a 5-month-old magazine. They can look at, people from April, or you can provide them with something else to do. The use of a touch screen or another educational device or even a screen up on the wall can reduce perceived wait times. They're still going to be there 20 minutes, but it can go a lot quicker. This will increase your patient satisfaction, lower stress, make the visit more productive. Now, the interactive, the touch screens, the iPads, those are probably more meaningful, but just don't discount a regular video loop that's up on the wall that could, provide information about diabetes, hypertension, COPD, or whatever your specialty is. Think about educational games that are out there and available for some of these devices. Now, even if only the young kids actually play the games or are using the touch screens, a lot of times the parents are watching over their shoulder and they just might learn something as well. So again, all these technologies are intended to make use of that, what could be perceived as wasted time in the waiting room, and it will make the wait seem shorter. You're going to get less complaints. You're going to lower the patient's stress. So you're probably going to get a more accurate blood pressure reading. You're going to improve your satisfaction scores, and maybe, just maybe, the patient will learn something about their condition, about their medication. Another tool that's out there and available today is check-in kiosks. Granted, with a check-in kiosk, you're not getting that personal interaction between the receptionist and the patient. But in some organizations, you might be large enough to where you can have these check-in kiosks available in addition to your reception staff. There was some pilot research grants out there that leveraged patient kiosks as a means of building an understanding of what the patients don't understand, building, to kind of get an idea of where there is a gap in care. What they did with these kiosks is, of course, the patient would go through the basic check-in stuff. They could do if they had a copay, they could process the copay, and then it would flash up a couple questions to the patient. Do you have any questions for the provider today? Do you feel like you understand your medications and how to remain adherent to those? Do you understand your conditions? Do you understand your diabetes? Do you understand how to control your diabetes and hypertension? Based on those responses, if a patient would say, no, I don't really understand this, I don't really understand my meds, that would send a notification to the care team so that then when the patient was back in the room, they could say, okay, so now you're telling us, we understand that you have questions. Let's focus on those questions. There was a pilot done at Thomas Jefferson University. They have a large hospital system. They got some grant dollars. They put some kiosks out there, and they found that 42% of their patients said that they do not feel competent enough to manage their medications. That triggered their care teams to focus on medication adherence, to make sure they spend the time with those patients, and they saw improved outcomes from it. Now we're going to look at a few of the technologies that we're going to start seeing in the future, or that we're going to start seeing used differently in the future. Now, everybody has a Fitbit. This is probably, this cartoon is probably not going to be too far from reality here in the next couple of years. The patient handed me wearable technology and said, hey, all the answers are on there. Well, you know what? That could not be too far from the truth. Now, with stage 3 of meaningful use, they introduced the concept of an API, or an application programming interface. This is going to be a requirement for all EHRs all certified EHRs. This goes for both the hospital and the outpatient settings. What the API must allow is access to the clinical information stored in your EHR. Third-party developers are going to leverage these APIs. They're kind of a standard programming interface. So you're going to see these third-party developers coming up with applications that can consolidate the clinical information stored in the 5 different portals that a patient has access to. So maybe they could pull it into like a personal health record to get a consolidated view of their information. Maybe the app pushes educational information, problem-specific educational information. Maybe these interfaces, these applications will push structured data from a wireless device into the EHR between visits. I really, really, really think these APIs have a lot of potential to increase true patient engagement, because you'll be able to provide focused, condition-specific applications. You're going to be able to collect meaningful structured data outside of the traditional setting, rather than having handing a patient a piece of paper and say, hey, fill this out every day and try to remember to do it. And that information, while it's good, just think about what the future could hold. And really the key to some of the patient engagement, or to getting some information back from the patient, is to limit the information and data that they have to input by hand, because they're going to forget to do it. They're going to make mistakes. But if you can get structured, meaningful data back between visits, man, there's just so much potential. Now, this is just kind of an example to think about, to kind of think about what the future may hold. Now, let's say you've got a diabetic patient. They're really struggling to control their glucose. They're up and they're down, or they're saying, yeah, I check my glucose every day, but you kind of think they may not be telling you the whole truth because their condition continues to worsen. There are phone-connected glucose readers. Now, those, unfortunately, they generally don't go much further than the device they're holding to, and that it's going to store the information in their phone. But you think about if a third-party developer takes the APIs that are going to be available in stage 3, and then when the patient takes their glucose reading, it immediately goes to the EHR, and then within your EHR you build alerts. Maybe Bob's having problems, so you've got an alert set up. So if they have 2 readings over a 3 or 4 day period where their glucose is really high, that you get an alert. You get a little pop-up. Maybe it's the physician who gets the pop-up, or some other member of the care team, or a care coordinator. If a care coordinator gets those messages, that could trigger, there are those chronic care management codes out there for billing this interaction between visits. Well, let's make use of that. Let's give real-time information to the care coordination teams so that they can contact that diabetic patient, get them in for a visit, so we can understand why those glucose levels were high this week. It's a tool to engage a patient at the time the problem occurs. Another example could be that you've got a hypertensive patient that's struggling with their blood pressure. You've kind of prescribed them with a care plan that involves a lot of physical activity. Maybe they aren't doing everything they need to do. You prescribe them a blood pressure cuff. You help them get the phone on their app, and you're syncing up their Fitbit. That information then goes to the care team, during the next patient visit, and you can sit down with that patient and say, hey, you're not active enough, or on Monday your blood pressure was sky high. Did you forget to take your blood pressure medicine? Were you under a lot of stress? Just a lot of really good information that can be collected that can really, really drive patient engagement, and again, limits the information that a patient has to manually key in. Think beyond just the blood pressure cuff and the glucose reader in the last example, but to other devices like heart monitors, sleep monitors, network-enabled scales that you could use to monitor the weight of a patient with heart failure. Any number of clinical specific applications. Think about the potential of patients who struggle to care for themselves. Maybe you have an older patient who's starting to show signs of dementia, and they're having problems remembering specifics of their care plan. But if you have these remote monitoring devices of wearable technology, that can feed back to you through your EHR. Just think of what you can really do with keeping those patients engaged or engaging those patients, whoever's providing care, whether it's a family member or a private care provider. But there's just so much potential here for patient engagement. Now, there are some barriers to patient engagement that we need to overcome. We've got to remove those barriers. We've got to find ways to limit the facilitation of true patient involvement. A lot of organizations, they don't really understand HIPAA, so they have some existing organizational policies regarding the sharing of information that are too limiting. Now, we got to make sure we adhere to HIPAA, but HIPAA has a clause in it for sharing information with the patient or with whoever is the primary caregiver for that patient. We just need to make sure that the policies match what HIPAA truly says. Also, we've got to remove the barriers of the impression that the EHR is disruptive to the relationship. By all means, it can be. And if you're focusing, you're only looking at your laptop, or it will impact your patient engagement and your relationship with your patient. But find a way so that it does not. Whether it's ongoing training, whether it's workflow analysis, you really can make the EHR a tool rather than a barrier. Another barrier is the different communication preferences of the patient population. There's no magic item that's going to work for everybody. You've got to make sure that you have individualized patient engagement. Of course, some of it does go back to the vendors. They really need to focus on the end user experience of the patient portal with these other tools. Make them intuitive, make them simple to use, make them work on various different technologies from laptops, desktops, portable devices. Also, I think a lot of the patient engagement programs are very limited in scope. Don't rely solely on technology. You will fail. Also, I think sometimes patients just receive too much information. They're drinking from a fire hose. A good patient engagement program provides ongoing education, ongoing just little pieces here and there to kind of build that knowledge for the patient. Now, I do want to go back up to the lack of organizational resources and the fear of failure limiting true innovation. What I mean there is that whether it's your IT department or somebody in your organization, over the past, 4 or 5 years, all folks have been able to do is to respond to new regulation. Whether it's meaningful use, PQRS, IQR, they're so focused on just meeting the next requirement that they've we really don't have a lot of true innovation going on. We don't have pilot projects out there that are testing new technologies or just testing new approaches without a fear of failure. Put money aside to where you can go try these pilot projects. And if it doesn't come out the way that's expected, don't treat that as a failure. Treat it as a learning opportunity that can feed into your next pilot project. Those little innovation-focused projects have a huge return at the end when you find something that works, that you can leverage to keep your patients engaged, lower cost, increase outcomes, increase patient satisfaction. Those are invaluable. Set aside people in your organization, set aside some money, some resources, and let them play. Let them find what the next big thing is. Now, we do have some upcoming webinars. Our next one is August 9th. This will be, again, in our Improving Ohio Health series. The next one is Making Your Patient's Care Plan Come Alive, Electronically Connecting the Community. And this is going to be presented by Dottie Howe, our Communications Director, and Karen Bishop. She's one of our folks on the implementation team. And we're going to involve a couple of groups that we've been working with. Then after that, we'll have impact of the new payment reform regulations on chronic care management, transitional care management. There's been a real flurry of activity with new regulations and modification of some old regulations. And then we're going to look at some technology to support your chronic care and transitional care management. Now let's talk about, let's go see if there's any questions, and it looks like we might have a few. Oh, also, before we get to the questions, we do have this webinar is funded through a project that we're working on with the Ohio Department of Health. This focused on diabetes and hypertension. We need data from organizations for this project. If you've not given us any data, or if you've not heard from Kathy or I, and you would be willing to share your CQMs, your provider CQMs, again, this will all be de-identified. But if you're willing to share your data, you want more information, contact us. We have Kathy Rich's email address here on the slide. You can send it to Kathy. She'll vet the question and make sure you get an answer. All right, let me pull up my questions here. Question 1. What are the differences between managing patient engagement in the hospital setting versus the practice setting? That's a great question because there is a huge difference. And again, this is my spin on it. You guys might have a different take on it, but when I think of patient engagement in the hospital setting, engagement is ensuring that it's going to be focused around ensuring that the patient understands their discharge instructions, and that they follow up with their primary care provider. So you could use a secure message a couple days after the patient's discharge. Hey, did you get an appointment with your primary care provider? That may get them to log into the portal. They're in the portal. Hey, there's their discharge instructions. There's their lab results. So it is a different focus. Now, of course, with primary care provider, it's about educating that patient and kind of continually building the foundation of health literacy and continually engaging that patient. It's going to be different as well in a specialty setting where, if you're an orthopod, you're going to have a different set of education. You're going to have a more limited time with that patient. When I say that, I mean, you're going to probably have a set number of appointments or a limited number of appointments with that patient before they go back to their primary care provider. So your patient engagement program is going to have a little different focus. All right, next question. My patients complain that all their different medical providers have different portal, and it's very different for the patient to remember all the sign-ins. How do I get them to engage, and are there any technology ways to correct this? This one's difficult because it is true. There's 100 different EHR vendors out there, and there's 100 different portals. Some health systems have multiple portals, which, patients do get overwhelmed with the number of logins they have to remember. So I would say that it's probably most important that a patient be engaged or stay connected with their primary care provider's portal. Not to say discourage them from using these other portals, but now think about these future technologies, these APIs that are going to be required. This may allow for a patient to use another portal that combines information. Today, all portals have a requirement that a patient be able to view, download, and transmit their health information. That download piece, if you use Microsoft Health Vault, I've done this with my own information, so I know this worked. You can download your information from a portal, import it into a personal health record like Microsoft Health Vault, or there's other PHRs that are available there. So that way, at least the patient can go to one place and kind of get a point-in-time consolidated view of their information, or just try to manage it themselves. Now, you are going to have a limited number of patients, kind of those techno geeks out there that are going to do this, but there are some techniques for assisting the patient. But if you're a primary care provider, that's the important portal that a patient uses. Next question. On the specialty level that doesn't manage hypertension or diabetes, what level do you need to engage in order to meet patient engagement quality if it is not related to what you are seeing the patient for? Well, you know, if you're an orthopod, you're an endocrinologist, you know, you want to build your education, build the information that you're pushing to the portal around your specialty. You know, if you're an orthopod, you're probably going to want to make sure your radiology results are flowing to the portal, but you've got good vetted patient education available in the portal that's specific to, you know, a broken bone, a hip replacement. But, you know, you want to encourage the patient when they're seeing you, saying, hey, for the next 5 visits, you're going to be coming back, you're going to be seeing me. What I want you to do is log into the portal so that way you can look over everything, and then when you come to see me about your hip replacement, you've got you've got that base of information. You've kind of taken a look at your surgery pre-op labs, and hey, there's some education there. But you know, make it specific to your specialty. Now, some of the portal vendors are going to do a better job than others with allowing you to do that configuration, but make use of every function that you can. Spend the time to build your portal out to specialize your portal around your specialty. Check chat to see if there's any questions in chat as well. Doesn't look like we have any other questions at this time. I want to thank everyone for attending. If you do have any questions, don't hesitate to contact any of the people on this slide. If you're interested in this project that we have going on now around hypertension and diabetes, contact any of these folks. If you have any questions about patient engagement or any other technology, your EHR or whatever, fire me off an email. A recording of this webinar will be posted to the CliniSync YouTube page here in a few days. Also, if you've not signed up for the CliniSync Connects newsletter, go to clinisync.org, sign up for that. We have, Dottie does a great job with that newsletter. We send them out every month. Wealth of information about the HIE and other regulatory programs. So again, thank you all for attending, and hopefully we'll see you next month.